Greetings, everyone. My name is Michaela Rainey, and I'm going to talk to you briefly about the opioid epidemic. This is for my SWK 523 Rural and Urban Social Welfare and Social Work class. So let's go ahead and get started. So, a little brief history on opium and where it came from is it's one of my favorite flowers. It comes from the poppy flower. Um, Sumerians of Mesopotamia first cultivated the opium poppy around 304,000 BC. It was considered the joy plant or the hungil. By 1838, the British were selling roughly 1,400 tons of opium per year to China, which was very interesting, being so that the government of British had outlawed it and banned it for use. So there was actually an open letter written to Queen Victoria about the moral of the British because they were continuously selling it to China and China was trying to ban it. So that created the first opium war. During that time of 1838, about 27% of the males of the Chinese population were addicted to opium. They were going to illegal opium dens and would spend majority of their time high on the product of opium. So generally, opium was created as a prescription drug, not just recreational use. It was prescribed to moderate severe pain after surgery or injury, pain from health conditions like cancer. When you think of opium drugs, you'll mostly hear it in oxycodone, codeine, morphine, or hydrocodone as some of the regular prescription drugs. But because of what it's used for as a painkiller, the risks are super high for misuse, addiction, overdose, and death, especially when people are using it long term. Opiates in the world. So, unfortunately, around the world, young adults are the most affected by the opium epidemic. 1 in 10 students in Lebanon, Saudi Arabia, parts of China, Spain, Europe, and the United Kingdom have admitted to, during surveys found by psychologists and social workers, to have tried it or at least used it once in recreational use. Also, Afghanistan produces 82% of the globe's illicit opium since 2012. Doctors around the world are less trained on drug addictions, the causes and treatments of it. So it has become a bigger epidemic around the world and not just in the United States. Around the world, it's also been shown that it's STD transmitted through the shared needles. Europe uses 3/4 of overdose death between ages of 15 to 39, and codeine abuse doesn't discriminate age or social class around the world. So its effect in the United States. So the United States has the hugest problem with the consumption of opioids. 80% of the world's pharmaceutical opioid supply is consumed in the United States. Sadly, 25.5 million people, or 2.5 million children worldwide, die without pain relief in middle-low income countries, while the U.S. produces and imports 30 times as much as it needs. So sadly, people suffering in Nigeria receive less than 0.2% of the need that they have for pain relief and painkillers. In the 1990s, overprescription of opioids, dubbed the opioid crisis by the United States by the Surgeon General. So because we were trying to figure out what the pain was for so many people, we ended up overprescribing painkillers to the general public. And sadly, as of today in 2019, most insurances for poor people won't pay for anything but a pill. So rather than finding alternative methods to help people with their pain, they're quick to hurry up and just pay for the pill because it is a cheaper option as opposed to therapy or other alternative methods. So this is just a little chart to show how it affects the United States, the opioid death. And as you can see in the darker areas, which I found to be very shocking, was mostly in the Midwest, which is where I came from. I'm from Ohio, and I see that they're 30.9 um, on the scale compared to other parts of the United States. But we'll get more into that on the next few slides. Where opioid misusers get their drugs from. So you would think, oh, it's just somebody over in the corner, in the alley selling illegal painkillers. But most people receive their painkillers from a friend or family member for free, who they probably got it prescribed to them by their local doctor. Then everyone else gets theirs from their doctor and end up getting an addiction from it. Then it goes into purchases from a friend or family, so it's no longer free. Then it goes to purchase from a stranger or a drug dealer, and then it's stolen from a clinic, friend, or relative, and then other. So, just are a few ways of how people obtain and misuse opioids. So, some statistics to quickly talk about um, opiates. So, over 130 people die each day from opioid related drug abuse, 47,600 and counting in the United States since 2017 have died from an opioid related overdose. 11.4 million misused prescription opioids yearly. 19,413 synthetic opioids have killed people. 886,000 people have used heroin, 15,482 deaths by heroin, and all these statistics come from last from 2016. And opioid overdose is fourth out of the top five causes of reported deaths. So first at the very top of the list is cancer, then accidents, diabetes, then opioid overdose, and lastly by firearms. So, in rural communities, the CDC analyzed patients' opioid prescription data from the Athena Health. In 2017, 14 counties were among the 15 counties with the highest opioid prescription rates. So, out of the 15, 14 of them were rural areas. The most rural counties had 87% higher chance of receiving an opioid prescription compared with those in large central metropolitan counties during the study period. So this was taken from a survey that was done by a group of social workers. And then it's no coincidence that opioid prescriptions first started in the most economically vulnerable places of the country, so the more rural communities. These places have been primed to be vulnerable to opiates, which are drugs that numb both physical and mental pain through decades of economic and social decline. So, for in urban communities, there is a greater access, so there's more accessibility for individuals to receive opiates. Um, they kind of crack down on the severity of urban communities with um, the war on drugs. So, where there's economic distress and a supply for opiates, it doesn't necessarily predict that the rate is going to be higher of opioid death, despite people being more accessible to it. Drug mortality rates aren't higher in economically distressed places simply because they have a greater access or greater supply of opiate prescribed to them. However, depending on the region and the areas, they can be affected. And we'll look at that on a state by state basis because you can't necessarily say that a rural community is going to be more affected than an urban community, or an urban community is going to be more affected than a rural community. It depends on the rural or urban area and the state and the region. So I want to do a little state to state breakdown, comparing where I currently live, Huntsville, Alabama, to where I'm from, which is Columbus, Ohio. So we'll look first at Huntsville, Alabama. The U.S. and Alabama opioid prescribing rate per 100 persons has actually declined since 2017. However, the rate is still way higher, almost three times as high than the United States overall in Alabama. So as of 2017, 107.2 people per 100 people were prescribed opioids compared to the US overall average of 58.7. Now we'll take a quick look at Columbus, Ohio, where the overdose deaths in 2016, the numbers represent overdose deaths recorded by the coroners, and not all of the counties provided their data. So I'm from Columbus, Ohio, which is right smack dab in the middle, and it's the dark area, and they had 353 deaths reported. Now, that to me is a lot because I never would have known or thought that there would have been an opioid problem or anything like that in where I'm from. But I am from a very urban, right smack dab in the middle of the city type of girl. So when looking at this, it just kind of shows that there are still areas that are sparse out. So like our more rural areas are the lighter colors, and then there's areas where there's no data reported. And then I found it really interesting that the county that I'm from, which is Franklin County, is actually third of the top opioid death areas. So it goes from Cuyahoga to Montgomery to Franklin, Summit, Hamilton, and Lucas. And again, Franklin County being right smack dab in the middle, whereas Cuyahoga and Lucas are more on the outskirts. And I also found it interesting that the main cities like Cincinnati, Dayton, Cleveland, Toledo had higher rates than all the others, which again are more urban, more populated areas. So, current state laws, programs, and resources that are here in Alabama to deal with the opioid epidemic is one, the Good Samaritan Law that was provided by 2016 that allows for practitioners to prescribe naloxone, I think that's how you pronounce it, which is an antagonist agent for those who are addicted to opioids and painkillers. It is a deterrent, whereas it used to be where you couldn't prescribe that and they had to give a leniency for certain practitioners to prescribe it back in 2015. And as of 2016, it became okay for just about every practitioner. Another way that Alabama is combating the opioid epidemic is they have National Prescription Take Back Day on October 26, 2019 from 10 a.m. to 2 p.m. And you can find this all on the Alabama Health Department website where they give locations where you can properly dispose of your prescription drugs. Some prescription drugs you can just throw away at home and think nothing about it, but there's other prescription drugs, such as anything with opium in it, um, that need to be disposed of in a different manner. There's also the National Helpline that helps people 24/7, 365 days a year with dealing with their crisis or their issue with any type of addiction. Um, they have the Alabama Prescription Drug Monitoring Program that helps individuals. They have toolkits that offer resources and prevent opioid related overdoses and deaths, and literature for individuals anywhere from adults to the youth. They also offer seminars, support groups, classes, and therapy for friends and family who have loved ones who are dealing with the addiction. And ADAPT Pharma has a training module online that you can actually do to help individuals identify opioid overdose, check for responses, properly administer Narcan nasal spray, which I had no idea what that was, and how to place a patient in recovery position until emergency medical assistance can arrive. So I found that to be very helpful. So, for future impact and potential resolution to this issue, there needs to be, in my opinion, more limits on opioid prescriptions because there has been more studies showing that some prescription painkillers are not even helping with the problem that they were thought to be helping at the time. So there may need to be more research done, but if we limit the amount of painkillers given to individuals, that could help this issue so much more because at the current moment, we're overprescribing painkillers and opioids to clients, to people who are then giving to friends and family or selling. There needs to be a crackdown on illicit fentanyl, which might be limited effectiveness when local economic conditions are struggling. So, just for financial reasons, we need to crack down on um, individuals who are legally making and selling synthetic painkillers to people. So that comes from the Justice Department and police officers cracking down on these labs that are out here. You can go on YouTube or Google and find ways to make um, these illicit drugs. So there needs to be more, I don't want to say censorship, but there needs to be something done on limiting what can be and can't be posted on the internet. Um, there needs to be more region specific research done. So again, what might work in one area may not work in another area. So, trying to find that common ground on how they can aid the opioid epidemic and stop it in its tracks kind of varies from location to location. And then there needs to be more focus on certain communities in this epidemic because as we've seen that, you know, Ohio's struggling compared to like the center. I don't even know how to pronounce it, but those there's more problems going on in in the urban communities. So, like in the bigger cities in Columbus, Ohio, Dayton, Ohio, Cincinnati, Ohio, there needs to be more efforts put onto cracking down on the opioid epidemic there, as opposed to in the smaller cities. And same with Alabama. Alabama is very high, even though most of Alabama is considered rural areas. There's still some large numbers that overpower the average of the United States, as I showed in my previous slide. So those are just a few of what I think should be ways to help with this epidemic in the future. And lastly, just my references. I hope you guys learned something. Sorry for all my rambling. I'm not very good at YouTube, but if you have any questions, feel free to let me know, and I'll be happy to aid you any way I can. Thanks for listening. Bye. So the theoretical framework for um, social workers is that social workers are going to encounter individuals, families, communities who are affected by the opioid epidemic, regardless of if they're working in rural or urban communities. So, due to a lack of research on opioids in rural communities, social workers are kind of at a disadvantage. So, it's kind of up to social workers to kind of become more knowledgeable and find out information from other social workers, from practitioners, basically anywhere they can to better aid and assist their clients. Clients with addiction to opium and opioids may be in need of more services and require longer treatment plans and interventions. So it's going to be a little more time consuming. So patience is going to be key for social workers when dealing with this population. Social workers will also need to be knowledgeable of legislation as well as resources and available treatment options to aid their clients because what may work for one may not work for another. So it just kind of depends. And there also needs to be more awareness in the social work community on preventative measures um, and just overall awareness in general on how they can help their clients.